looking at the humanity in the suffering in these scenarios. So this is a map that doesn't have Ukraine on it. It was written before this dreadful war, but it does show us something about what happens when people are forcibly displaced, when conflict or natural disaster, as Catherine talked about, and the impact on the countries round about, and the fact that most go to countries round about with the challenges that then come, and Omar explained that from Jordan. Please go to the next slide. And of course, much of the initial response is around the acute events, but we need to remember these more chronic and longer term events. I also want to draw your attention, if you haven't seen it, to this recent indicators document. I know that many people on this call have had input into this. It's absolutely excellent. This diagram is absolutely excellent. It just takes the umbrella diagram a whole step further. And I think use these principles, these principles to think of how we should respond in the acute setting and in the more medium and long-term setting. And I think if you haven't seen this before, you can find this in this document, and maybe somebody could put a link in the chat just for folk to be able to find this. And it's really useful in a number of areas. I've just come from Gaza, and we've been discussing how to develop palliative care using this overall approach. Next slide, please. Okay, so again, you've talked about this. I think I won't say much more about the sphere guidelines, but I draw your attention to one more document. This is the Quality of Care in Fragile, Conflict-Affected and Vulnerable Settings, a WHO document. Our WHO colleagues feel very strongly that palliative care is a core component of quality of care. I think we know that in palliative care, but that is recognised more broadly. So let us also make our advocacy and our arguments, and also our research and our interventions, looking at what is quality. And if you just do one more click, I think you'll see the indicators of quality that are contained in this document. Joanne, if you could just do one more click for me. There we go. And so the need to do some of these things. And the WHO document before on humanitarian setting did encourage us to do some of these situational analyses and to do that in a shared way. I saw the first comment at the beginning of this call was about shared issues and making sure that that's culturally sensitive, and that has to be a genuine partnership. And I could see this today from our Ukrainian colleagues. Next slide, please. I think we also know the pandemic has if you like, accelerated this understanding of global suffering and the role of palliative care. And we need to grasp that moment as well. Next slide, please. Now, I want to just bring out some examples. You've heard about Gaza. We do hope and pray that the situation in Ukraine will come to an end soon. For our friends in Gaza, this is now since 1948, for many of them 1967, for others with repeated episodes of conflict. So what are the kind of responses there? I want to just draw out some work done by the Gaza Community for Mental Health, because we've been talking about psychosocial needs, and of course we'd add spiritual in there, would we not, in palliative care? But let me just look at the response to a particularly recent outbreak of violence last year, where 36,000 were involved, and a number of people killed, including children, and a number of sequelae. When you think of 1 in 5 of those hit by live ammunition, you can just imagine the chronic pain problems and the holistic problems left by that just 2 years ago. Next slide, please. So I want to show you some of the interventions and pay tribute to Dr. Yasser Abu Jamal, who I meet every time I go to Gaza, an impressive man working in community psychiatry. So this is a multi-sectorial intervention where there was training, including people like emergency response teams. Really interesting. I know that there's a group looking at this in Ukraine. I think there are things to learn from our colleagues. Therapeutic interventions at home and in mobile stations, those with obviously established mental health diagnoses who are able to attend clinics, and also telephone support, and building in some psychoeducation and resources so that it's not all dependent on the very few mental health trained people. Next slide, please. I'm going through fast, but just giving you some tips. Training, we need to look at transformational education. And I'm always incredibly humbled how much of this has actually been worked out by our colleagues. These are medical students in Gaza. These are people who for 14 years aren't able to travel, huge impact on their lives. And yet, what were the values they were identifying when we were learning palliative care today? Just look at them. Love and compassion and hope and mercy and dignity. And one young man saying palliative care is humanity until infinity. You know, that's a fascinating concept, isn't it? And I think it's been that kind of concept is there in our discussion. So let's work with our colleagues, and we don't need to teach about values healthcare, but we need to respond in that way. Next slide, please. We've also talked about integration, and I think that's hugely important. And Catherine, you made this point, and I'm not going to remake it. I'm just going to give you some examples from work in northern Uganda, where there are 1 million refugees from South Sudan. Next slide, please. And where integrated palliative care interventions are focused around building capacity, and that includes family caregivers and VHTs, as well as healthcare workers and policymakers. Very, very important, engaging communities and families. For example, place of care discussions, cultural understandings of health, that needs to be very much led from within the community, and building that, if possible, with the host and the refugee community together. So that's a new community, if you like, that has been bonded because of displacement, but you don't want to build in divides and separations. And also looking at the whole issues around resilience, easy words to say, difficult words to actually put into practice. Next slide, please. Just giving you little snippets. And this, you can't see all of this. And Joan, you want me to finish, Graham. So this is needs assessment.
Thank you.
Yep. Needs assessment work, research work, using photographs to do voice, situational analysis, using qualitative tools, and engaging the healthcare workers. I won't show you the slides and the pictures, but all of this information comes from partnerships with local people on the ground, with their stories and their words, and with humanitarian actors engaged. Lots to learn about. I'll finish there and hand over to Stephen. Thank you so much.
Thank you so much, Moira. There is so much we can learn from each other. And so, Stephen, you should have been first, but now we're asking you if you will finish off this wonderful webinar. Thank you so much.
Actually, it'll work out fine. I'd like to control the slides, please. Let me do that. Okay.
Just give me a second to get back to your slides, Stephen.
No, I'll do my slides, please.
Okay, perfect. You share. Yeah.
Well, great to be with everybody. And actually, I'm thinking it's probably good that I'm the closing speaker, because I thought I would put a highlight on something that we need to include in the discussion, which is the impact that humanitarian crises have on the need for palliative care and also grief and loss. Omar has covered some of these statistics, but it is staggering the number of people needing help in humanitarian crises. It actually dwarfs the number of people needing palliative care. We have recently published that we need palliative care for around 60 million people a year. And that we don't really know how many people in humanitarian crises need palliative care. And that is a critical piece of information we need to do more research on. And as we've said, most people have non-communicable disease, living in low and middle income countries, mostly older, but children, we can't forget children, and families. And the families that need palliative care and need help in humanitarian crises are the ones who experience most of the grief after a death. It's a consequence of humanitarian crises that people will experience grief, and many times complicated grief. For each death, we believe up to 9 people are directly affected by the loss. We've had about 120 million people die on the planet in the last 2 years, and that includes 6 million from COVID. But that's over 1 billion people needing support in grief and loss each in this 2-year period. And many of them may have experience with complicated grief, what is now being referred to as prolonged grief disorder, which could be up to 40 million people. It's just a staggering number. We are going to be focusing this year on healing hearts and communities as part of the theme for World Hospice and Palliative Care Day, and it'll be focused on grief and loss and healing from the pandemic and from all. We want governments to begin to take this seriously and start to focus on the needs for people who have experienced loss in the community, with both primary, secondary, and tertiary interventions depending on the need. It's kind of the usual triangle of we need compassionate communities, we need support for people, particularly in humanitarian crises. We need additional support. I'll end this with and I'll put in the chat the link to this. Palchase, WHPCA, International Children's Palliative Care Network are sponsoring a global giving campaign for supporting palliative care patients in Ukraine. And we're about to send our first payment to Alexander for supporting his work in Ukraine. And on that note, I think we might have actually 2 minutes left. Geez, here comes the chat.
Stephen, you're fantastic. Thank you. Thank you so much. You're wonderful. And so it's my pleasure now to thank each and every one of you. Our speakers have been incredible. We've learned from those within Ukraine, from those on the borders, and those from the global perspective as well. And so thank you. And thank you to each one who's present today. I realize we didn't have time for conversation, but we are looking at perhaps a follow-up webinar. We will have more time to discuss, and there will be a meeting at the Maritza Conference in Rome next week on the 27th at 5 o'clock in the evening, where we will be looking at lessons learned from Ukraine and around the world and how we can use it to go forward with children. So a big thank you to Joanne for all the organization, and to Catherine and to EAPC. And if you would like to join the EAPC Migrant and Refugee Task Group, please contact Joanne. And if you would like to join Palchase, it's palchase.org. And go into our website. So thank you, everybody. Have a wonderful day, whatever's left of it. And for those who got up at 2 o'clock in the morning, bless you.
Thank you very much.
Everybody, take care. Be safe.
Bye.
Thank you very much. Thank you. Thank you, Stephen.
Yeah.
And thanks very much to Joan. Thank you very much, Joan, for all your hard work.
Recording stopped.
Fruition.
Amazing. Yeah, amazing.
It was very moving, very powerful. And yeah, I just think that we can learn so much from each other, and we can learn so much from what is happening in Ukraine now, that we have to learn. We have to prepare for the future now. Yeah. It would be criminal for us not to do that. When we have the knowledge, we have seen what is needed, that it's a challenge. We have to take it forward.
I think I have to leave, right?
Thanks, everyone. I'm going to have to close the webinar because we're going to rush off to the next one. So thank you very much,
Joanne. Thank you, Joanne.
Bye, everyone. Thanks again.
Take care.
Thank you.
Bye.